Hey everyone, welcome back to ShockDoc Medical. I'm Dr. Raad, and today we're getting into some seriously fascinating ground. Have you ever thought about how a simple rash can actually tell us a huge story about a person's overall health? Like, what if that little patch of discolored skin is actually a clue to something bigger? Buckle up, because today we're diving deep into the art of skin examination, specifically for rashes. And I promise you, there's way more to it than just a quick glance. Now, whether you're a fellow clinician, a medical student, or just a curious soul who loves to understand how our bodies work, this episode is packed with details that can really change the game. We're talking about everything from the initial inspection of a patient to the minute details you can feel when you palpate a lesion. So, grab your coffee, get comfy, and let's break this down, just like a conversation over a laid-back afternoon. All right. So here's the rundown. When you're examining a patient with a rash, the first thing you need to do is step back, literally. Start by looking at the patient from the end of the exam couch or bed. This gives you an overall vibe. Does the person look healthy, or are there signs they might be septic, malnourished, or even in some life-threatening situation? That initial visual can be a huge clue. Once you've got that big picture, it's time to narrow it down. Ask yourself, is the rash localized to one specific area, or is it generalized? This helps point you in the right diagnostic direction. And here's a neat trick. Check if the rash is predominantly symmetrical. If it is, that usually suggests a systemic or internal cause. On the other hand, if it's asymmetrical, it might be something external like an infection, trauma, or even contact dermatitis from that new detergent you tried. Now, another key piece. Does the rash favor certain areas of the body? Maybe it shows up on extensor surfaces like the backs of your elbows or knees, or on flexural surfaces where the skin folds. Sometimes it might even be on light-exposed skin or have an acral distribution, meaning it appears on the fingers, toes, ears, or nose. Each of these patterns gives you a unique clue as to what's going on. And here's something I find super interesting, the Kubner phenomenon. That's when a rash shows up along scars or areas of previous trauma. If you see that, it's a pretty big red flag about how the skin is reacting to previous damage. All right, moving on to the next step, let's talk patterns. When you look at the rash, really take note of how the lesions are arranged. Are they grouped together, scattered, or even forming a generalized pattern? You might see linear formations, annular or ring-like patterns, reticulate, which is like a net with spaces, or even serpiginous, that's snake-like curves. Each of these patterns isn't just for show. They actually hint at different underlying conditions. Imagine it like a detective novel. The way the clues are arranged on the skin can help you solve the mystery of the patient's condition. Now, here's where things get a bit more hands-on. Once you've done your visual inspection, it's time to get in close and actually feel the skin. But before you start, a quick tip. Always ask the patient if the rash is tender. You don't want to accidentally cause them any discomfort. As you palpate, try to describe the primary lesion as precisely as you can. Ask yourself, how did the rash start? What shape are these primary lesions? Are the borders of these lesions well demarcated, or are they fuzzy and indistinct? This will help you figure out whether the problem is mainly in the epidermis, the top layer of the skin, or deeper down in the dermis. And let's talk texture. Does the surface look scaly, which would point to an epidermal issue, or is it smooth, suggesting something going on in the dermal layer? Don't be afraid to gently scratch the surface. Sometimes that's when you notice the little details that really make the difference. Next, check whether the lesions are raised or flat. This might sound basic, but feeling them out with your fingertips can provide crucial information. And then there's the color. Look at how the redness behaves. If it blanches under gentle pressure, that indicates erythema, which is just an increase in blood flow through the small vessels. But if the redness sticks around, you might be dealing with purpura, where blood is leaking into the skin. Another aspect is temperature. Does the involved skin feel hotter or cooler than the surrounding areas? That's another subtle clue that could point to inflammation or infection. And if you see any blisters, size matters here too. Small, easily ruptured blisters might suggest an intraepidermal issue, while tense blisters with a thick roof could mean a subepidermal blister is at work. Basically, The entire epidermis is acting like a protective roof. Oh, and keep an eye out for milia, those tiny white intradermal keratinous cysts, usually less than 3 millimeters. They often show up in subepidermal blistering diseases and can be a neat little detail to note. Don't forget to check for any signs of excoriations or erosions, which are usually secondary to scratching. And if you notice the skin is thickened, what we call lichenification, that might indicate chronic rubbing. Also, ask the patient if they've noticed any evolution in the lesions. Are there color changes or scars that have formed over time? Lastly, use your nose. If the area smells off, that could be a hint of an anaerobic infection. Yeah, it might sound a bit gross, but trust me, sometimes a whiff is all you need to get a clue. You know, I've been doing this for a while now, and it's amazing how these small details can add up to a big picture. I remember one case where a seemingly minor rash turned out to be the first sign of a systemic condition that, if caught early, made all the difference in treatment outcomes. It's those moments that remind us how crucial a thorough skin exam is, not just for doctors, but for anyone interested in health. For our fellow clinicians out there, remember that every detail counts. From the symmetry of the rash to the exact texture of the lesions, these observations guide your diagnostic decisions. And if you're a medical student, keep practicing these steps. It's like learning a language. At first, it might seem like a lot of detail, but soon you'll be reading skin like an open book. Let's chat about this for a minute. I'd love to hear from you. Have you ever had a case where a detailed skin exam changed the whole course of diagnosis? Maybe you noticed a pattern or a texture that most would overlook? Share your stories and questions in the comments below. Let's get a conversation going among us medical minds. Also, while the article we're discussing is purely about examination techniques, it's worth noting that this systematic approach forms the basis for any subsequent treatment. And while we're not diving into specific medications or dosages today, because this topic is all about diagnosis, remember that an accurate diagnosis is the first step towards effective treatment. Knowledge is power, folks. All right, to wrap this up, here's the takeaway. A comprehensive skin exam for rashes isn't just a checklist. It's an intricate process that can reveal so much about a patient's overall health. Start with a thorough inspection. Check the general health of the patient, decide if the rash is localized or generalized, and note its symmetry and distribution. Then, move in closer with palpation. Ask about tenderness, describe the primary lesions, and evaluate texture, shape, color, temperature, and any evolution in the lesions. And don't forget to check for those subtle clues like excoriations, lichenification, and even any funky odors. This systematic approach is a game changer. Whether you're a seasoned doctor or just someone who loves to geek out on medical science, these details can literally make the difference between a misdiagnosis and life-saving intervention. If you enjoyed this deep dive and found it useful, please hit that subscribe button, give us a thumbs up, and share this episode with your colleagues and friends. And hey, let's keep the conversation going. Drop your thoughts, stories, or even questions in the comments below. Next week, we're gearing up to explore another groundbreaking topic that might just change how we approach medicine altogether. I'm Dr. Raad, and you've been listening to ShockDoc Medical. Thanks for tuning in. Stay curious, and as always, keep questioning and learning. Catch you next time.